Welcome to the Queensland Ambulance Service Clinical Practice Manual. Over the past 6 to 12 months, we have researched what is contemporary in pre-hospital care, reviewed what we've been doing in the past, and produced a new practice manual for all officers. The Clinical Practice Manual forms one part of a clinical vision or journey or pathway for our service over the next 3 to 5 years. We really see this as an important part of a new level of professional development for our officers. Firstly, to learn new concepts, consolidate others, and take everyone on that journey towards potential paramedic registration. All the changes in the Clinical Practice Manual are evidence-based. So, in fact, every officer will receive a hard copy of the Clinical Practice Manual. They will have access to an electronic copy on the DES portal. And importantly, all the references will be hyperlinked. So when you need to see why we've made the decisions we have around our future practice, it's all evidence-based. It's important to remember that the Clinical Practice Manual is not a textbook. It really is a roadmap or a guide for all our officers as we traverse what is contemporary pre-hospital care. Those references allow you to do further reading should the need arise. By now, everyone should have a Clinical Practice Manual, and I'm sure you've all read it. Well, maybe not so, but it is important that you read it from cover to cover before you come for your 2 days of professional development. During those 2 days, what we'll do is reinforce what's good, what's new, and where we want to take the service. Those concepts are incredibly important for us to take the service on a journey and take all officers on that journey. This is about ensuring that we remain contemporary in our practice. Some of those concepts that are important for our officers are the new treatment, how we use oxygen, how we treat our COAD patients, how the slight changes in cardiac arrest management can actually provide even better outcomes than what we have now. There are a number of very subtle changes which we'll work through as well. It's a really exciting time for every officer, and I encourage everyone to read it from cover to cover. The plan is to ensure every officer gets access to those 2 professional development days sometime in a 12-month period, ideally as soon as possible. After that 2 days, we'd ask officers to go back on road and consolidate what they've learned. Approximately 3 months after that initial review of the CPM, we'll ask officers to come back for a validation day. There's absolutely nothing to fear about validation. This is about officer choice. For our ICPs, ultimately, they're working as ICPs. For our ACPs, we'd ask you to choose. Moving forward, we're going to have 2 levels of ACP practice. ACP Level 1, ACP Level 2. ACP Level 2 is essentially the same practice as we currently do at P3 level, except we're going to make 12-lead acquisition mandatory. Some of you might ask, why would we do that? Well, it's important because the 12-lead ECG is the most important point-of-care test we can do for our patients with chest pain. The QAS leads the country in cardiac reperfusion strategies. We want to continue to lead it, and it's important that our officers acquire those ECGs very early. Not when they're back in the unit, but actually in the house, where someone's sitting in their bed. Diagnose that STEMI very early, diagnose the acute coronary syndrome early, and then we can work on reperfusion strategies and taking them to the right hospital the very first time. Given the majority of our officers are at P3 level, this should be a pretty easy change, and we'll encourage you to get through it. There are a number of other interventions for ACP Level 2 that we'd like to introduce. One of them will be chest decompression under consultation. Others will include a number of new medications. I know there are a group of officers who struggle to practice at current P3 levels. For those officers, we actually have developed a whole new baseline standard, and that is ACP Level 1. Now, why have people struggled? Some of them have struggled because they don't have access to the case mix, the case numbers. Some people have struggled because they find some of the new changes just difficult to deal with. That does not devalue them as officers in our minds. They are really, really important to the service. They are great paramedics. They're great patient advocates, but they do want to make a difference to our patients. At ACP Level 1, what we've done is taken away some of the more difficult technical issues for paramedics. We still want them to provide analgesia. They will. Intramuscular morphine. We want them to stop seizures. Intramuscular midazolam. We want them to actually be able to provide care for a person who's vomiting. Intramuscular ondansetron. A number of other medications will be there as well. It's important. These officers will be of value to us, albeit the expectations of their practice will be slightly less than at ACP2 level. Ultimately, it's the officer's choice. If you want to practice at ACP2 level, you'll see a scope of practice, and we'll expect you to practice at that level. You'll expect yourself to practice at that level. And that's what validation is about. Let's work out, can you get there? And if you want to get there, we will encourage you, we'll work with you, and we will get you there. Alternatively, if you look at the scope of practice for ACP level 1, and you say, look, I think that's for me, I can still really do good things for our patients, and I feel more comfortable at that level, again, we'll support you there as well. But the scope of practice for our officers will be very well set out, so there's no surprises. We have our expectations of you, as you have your expectations of us to provide you with the background, the professional development to undertake your practice. We'll work together to make this a really successful program. For our P1 officers, the CPM is an important document. There are changes that affect your practice as well. In fact, they affect all paramedics' practice. So it's important that you're a part of this validation process as much as anyone else, and we will expect you to be part of it. You'll also have the 2 days of professional development, followed by the day of validation 3 months later. Again, the process will be very supportive, and we're looking forward to your involvement. Intensive care paramedics. Well, you'll undergo a validation as well. Nothing to fear about that. It's important because you're practicing at such a high level that we ensure you feel both comfortable and you're performing at the level we expect, and more importantly, what you expect of yourselves. Intensive care paramedics are practicing at a very high clinical level. There are high expectations from the organisation, from our patients, but most importantly from the paramedics themselves. As part of our validation, our clinical journey towards registration and our clinical journey to ensuring that we have a comprehensive development program for all officers, we have to make sure that paramedics are comfortable to practice at that very high level. We are there to empower them to do that. Moving forward, we need to accept that certain groups of paramedics who may work in lower case volume areas have actually extra access to professional development activities. That just makes common sense. So moving forwards, that's what we're going to do. Essentially, every intensive care paramedic will have a tailored professional development program for them. This is what we need to do to ensure we all practice at such a high level. We're doing the same thing with our advanced care paramedics. On a larger group, it's somewhat easier to do. On a smaller group, performing at a very high clinical level, it is a little bit more difficult. But on that basis, we'll make sure you get access to professional development. The onus is also on you to undertake self-directed learning, as it is with all officers. But in combination, we'll produce a fantastic package for everyone to move forward into the future. There's nothing to fear about the validation day. It really is a day to consolidate what you've learned 3 months earlier and then put into practice on road. At the end of the validation day, we'll actually provide you with credentialing to perform at a certain level, your authority to practice. The day is nothing to fear. There'll be an open book exam, there'll be some scenarios. In fact, you'll know what the scenarios will be before you get there, because the scenarios are tailored around what are the new concepts. We just want you to demonstrate that you've understood the new concepts and you can put them into practice. There'll be a viva with a clinical support officer or equivalent, where you can discuss the new concepts and know that you grasp them. There's no score out of 100. It's just important to show us that you're heading in the right direction and you're practicing at the level we want you to practice at. And more importantly, you're practicing at the level you want to practice at. You're professional paramedics. It's an expectation of yourselves and of the community that you'll be able to practice at the level that we expect. In fact, you're governing your own destiny. We're here to support you. For some individuals, they may not be showing that they can practice at the level they want to practice at. We're not going to cut and run. The important thing is we're going to develop up learning support plans to get you there. This is a journey we'll take you on. It's important. We will be there to support you. Ultimately, this whole process, and the CPM is just one link in the chain of professional development for the future. Really, we want to work forward. Working forward is about every year we'll have professional development activities. Also creating options for our officers to do their own self-directed learning. I've asked asked QCSA to develop up options in terms of multimodal education. So over the coming years, everyone across the state will have access to that. We accept that different officers work in different areas. They have different case mix. They have different case numbers. So what we need to do is tailor professional development for all our officers to ensure they are working at a very high level. Not that they're not doing that now, but we can make it even better. And that's what this is about. So I would encourage everyone not to be fearful, but to embrace it. As we head forward, we're setting the groundwork for professional paramedics and registration. That's very important. That's our long-term goal, is to make sure that our paramedics slide through that process, although there's nothing to worry about, because we're already there. These types of new concepts are important for us as a group to go forward. We'll be there to help you.